Hey everyone, welcome back to the channel. Have you ever had one of those nights where you're up 3 or 4 times to go to the bathroom? You stand there waiting and nothing happens, or it's just a tiny trickle. If this sounds familiar, you are definitely not alone. And before you start searching for some magic pill online, I want to share something fascinating. The secret to a happy prostate might already be sitting in your fruit bowl. I'm talking about the humble apple. Now, here's a medical fun fact you probably haven't heard. The prostate gland actually contains 9 times more zinc than your liver 9 times. When your zinc levels drop, that's when the prostate can get inflamed, enlarged, and start causing all those annoying bathroom issues. Back in the day, before modern meds were everywhere, some European doctors used what they called apple therapy to help men with urinary problems. And guess what? It actually worked. So, how can this simple fruit be so powerful? Stick with me in this video. We're going to break down exactly why your prostate loves apples and, more importantly, how to eat them to get the most benefit. We're going to help you find that smooth, complete flow again. First stop, let's talk about what the prostate actually is. First, let's talk about what the prostate even is and where it lives. A lot of guys might not know, and that's totally okay. I have patients in their 50s and 60s who've never really thought about where it is until something starts bothering them. The prostate is a small gland that's only found in men. Its size about the same as a walnut. You heard that right, like a walnut or a chestnut. Its main job is to make prostatic fluid, which is a key component of semen. So it plays a huge role in male reproductive function. But here's where things get tricky. It's in a really inconvenient spot. And honestly, it's this location that determines all the problems when something goes wrong. It sits deep in your body, right below the bladder and in front of the rectum. And most importantly, it wraps around the urethra, the tube that carries urine out, like a donut. Think of it like a garden hose. If someone squeezes it in the middle, what happens to the water flow? It gets weaker, thinner, or stops completely. That's exactly the relationship between your prostate and your urethra. When you're younger, the prostate behaves itself and the urethra is wide open. Peeing is powerful and satisfying. But as we get older, or if it gets irritated from other things, the prostate can become inflamed and enlarged, what we call BPH, or benign prostatic hyperplasia. And as it gets bigger, it squeezes that urethra from all sides, and that's when all the trouble starts, the weak stream, the frequent trips to the bathroom, all of it. 7 signs your prostate is trying to send you a memo. Your prostate can't talk, but it's really good at sending signals when something's wrong. These signs are very obvious. And I want you to take a few minutes to check in with yourself. Here are 7 classic signs to watch for. Signal number 1, a split stream. You're standing there expecting one strong focus stream, and instead it comes out as 2 or even 3 separate streams. Not only is it weak, but it also makes a mess. This usually means the prostate is inflamed or mildly enlarged, making the section of urethra it surrounds uneven, so the urine stream gets divided as it passes through. Signal number 2, the shower head effect. You know that feeling when the urine doesn't shoot out at all? It's not coming out as a stream. It's just kind of sprinkling out like a loose shower head right at your feet. This often means the prostate has become more swollen or enlarged and is pressing harder on the urethra. Signal number 3, start and stop urination. This one is honestly just miserable. You're going, and then suddenly it just stops. You feel like there's more in there, but you can't get it out. You have to take a deep breath, bear down, and really push to get the rest going. Again, this is super common with an enlarged prostate. Signal number 4, a very thin stream. This is the most obvious one and also the most ignored compared to that strong, powerful stream you had when you were younger. Now, it's just a thin trickle. And look, don't brush this off as no big deal. This is direct evidence that an enlarged prostate is literally squeezing your urethra shut. Signal number 5, short range. There's an old joke. When you're young, you can pee 3 yards against the wind. When you're older, you can't hit your shoes with the wind at your back. Behind that joke is a real battle between your bladder function and the resistance from your prostate. The enlarged prostate creates more resistance, so your bladder has to work way harder to push the urine out. Naturally, it doesn't go as far. Signal number 6, post. Urination dribble. You think you're finally done after a tough time peeing. You breathe a sigh of relief. You pull your pants up, and then a few drops end up in your underwear anyway. That classic incomplete emptying feeling, like there's always a little left. It's super common and really annoying. Signal number 7, Frequency, urgency, and nighttime urination, besides how you pee, how often you pee matters too. Constantly feeling the urge, feeling like you just went and you have to go again. That's frequency. Having to run to the bathroom immediately when the urge hits, that's urgency. And waking up multiple times a night. That's one of the biggest ways prostate issues affect your quality of life. If you've got one or two of these signs, it's time to start paying attention. If you have three or more, then I strongly recommend you go see a urologist at a good hospital and get checked out. Don't put this off. The 4 habits that are secretly hurting your prostate. Prostate issues usually don't happen overnight. They build up over time, and they're closely linked to our long-term daily habits. Here are the top 4 habits I see in my practice that can really hurt your prostate health. These might be hiding in your everyday routine. The first habit, sitting for too long and too much pressure. Modern life revolves around sitting, whether you're an office worker, a long haul truck driver, or you're retired and love watching television or playing cards at home. We sit a lot. When you sit for long periods, all your body weight and pressure concentrate on your pelvic area and perineum. This directly restricts blood flow in the prostate area, causing metabolic waste to build up. It's like a stagnant pond. Eventually, it's going to cause problems. And I have to specifically call out long distance cycling. A lot of people think cycling is healthy, and it can be. But the key is moderation. When you're sitting on that narrow, hard bike seat, all the pressure goes right on your perineum. The prostate gets squeezed between the seat and your pelvic bones. A short ride, no problem. But riding for an hour or two straight, that constant pressure and vibration can directly cause the prostate to become congested and swollen. It's a major cause of chronic prostatitis. The second habit, an inconsistent sex life. A lot of men don't realize this, but the frequency of your sex life has a direct impact on prostate health. It's all about balance. Too much or too little can both cause problems. If it's too frequent, your prostate stays in a constant state of excitement and congestion. It never gets a real chance to rest and recover. Think of it like a machine running non-stop. Eventually, it's going to overheat and get inflamed. But going without any sexual activity for a long time is also harmful. Your prostate makes fluid every day. If you don't release that fluid through ejaculation, it builds up inside the prostate. It can't drain out. This causes the tiny tubes inside to get blocked, pressure builds up, and it triggers discomfort and symptoms. We call this prostatic fluid retention. So what's the right frequency? There's no magic number, but there's a common guideline that I share with my patients. Take it as a rough reference, not a strict rule. For men in their 30s, about 7 times over 20 days. For men in their 40s, about 6 times over 30 days, roughly every 5 days. For men in their 50s, about 5 times over 40 days, roughly every 8 days. Again, this isn't carved in stone. The most important thing is to find a regular rhythm that works for you and your partner and stick with it. The third habit, constipation. This one surprises people. How does constipation affect the prostate? It seems like a gut issue. Well, it comes down to location. Your prostate and your rectum are literally next door neighbors. They're only separated by a thin wall of tissue. If you're chronically constipated, those hard, dry stools sit in your rectum for a long time and they physically push on your other neighbor. The prostate, over and over again, this constant pressure can trigger or worsen inflammation and discomfort in the prostate. So keeping things regular down there is actually an important part of protecting your prostate. The fourth habit, a heavy, spicy diet. You are what you eat, applies perfectly to prostate health. Let's break it down. First, alcohol, whether it's beer, wine, or cocktails. Alcohol causes blood vessels to expand. That leads to congestion in organs throughout your body, including the prostate and that congested state. That's a perfect breeding ground for inflammation. Second, spicy foods, things like hot peppers, chili, garlic, and strong spices. Some of the compounds in these foods get processed by your body and end up in your urine. So when that spicy urine flows through the section of urethra surrounded by an already irritated prostate, it's like pouring hot sauce on an already sensitive area. It can make swelling and inflammation much worse. And finally, greasy, high-fat foods. Think potato chips, fried chicken, rich fatty meats. These foods don't just pack on pounds. Studies have shown a clear link between diets high in fat and red meat and an increased risk of both BPH, prostate enlargement, and even prostate cancer. Why are prostate cancer rates so much higher in the United States and Europe compared to some parts of Asia? There are multiple factors, but one major reason is diet. The typical Western diet, heavy on red meat and high calorie processed foods, plays a significant role. The simple, powerful secret, the apple, okay, after all that heavy stuff, you're probably looking for some good news. Is there a simple, effective way to protect your prostate? Yes, absolutely. And the secret weapon might just be sitting in your fridge right now. It's the apple. I know, you might be laughing. An apple, really? That's it. Yes, true. Powerful things are often found in the simplest places. Apples have been called the king of fruits for a long time, and their special benefit for men's prostate health that was discovered a long time ago, even before modern medicine, back in Europe. When medications weren't as advanced as they are today, some doctors came up with a natural treatment for chronic prostatitis. They called it apple therapy. The method was incredibly simple: have patients eat 1 or 2 apples every single day. And amazingly, after sticking with it for a while, many patients saw their frustrating symptoms get better, sometimes even disappear completely. So, what's the science behind this? With modern research, we finally figured it out. The key is zinc. The prostate is a unique organ. When it comes to zinc, it absolutely loves the stuff and soaks it up. The amount of zinc in your prostate is incredibly high, on average 8 to 9 times higher than in other organs like your liver or muscles. Why does the prostate need so much zinc? It uses zinc to make a special type of protein. This zinc containing protein has strong antibacterial properties. It acts as the prostate's own natural antibiotic, helping it fight off bacterial invaders. And this isn't just theory. Lots of clinical studies have confirmed it. In almost all men with chronic prostatitis, the zinc levels in their prostate fluid are significantly lower than normal. So, by giving your body and especially your prostate plenty of zinc, you're basically building a strong defense line for your health. The benefits of getting enough zinc go even further. One study from France looked at men over 40. They found that men who got adequate zinc each day showed significant improvements in certain health markers, including an increase in something called plasma albumin, which is linked to healthier aging. So, getting enough zinc isn't just about protecting your prostate, it's about supporting healthy aging overall. How to use this information: 3 simple ways, okay? So, we know apples and zinc are important. How do we actually use this in real life method? Number one, the direct approach. The simplest way is to eat 1 or 2 fresh apples every single day. And if you can, eat the skin too. The peel contains a lot of good nutrients. Method number two, the easier approach. If eating 2 whole apples feels like too much, or if your teeth aren't what they used to be, fresh apple juice is a great alternative. Juicing makes it easier for your body to absorb the nutrients quickly, of course. Freshly juiced apples with no added sugar is the best way to go. Method number three, get creative. You can also add apples to your daily routine in other ways. Slice them up and put them in your morning oatmeal, or bake an apple with a little cinnamon for a healthy dessert. It's an easy way to work them into your day without it feeling like a chore. Bonus, 3 acupressure points for prostate health beyond diet. There are also some simple acupressure techniques that can really help. These come from traditional medicine and focus on improving energy flow. Try spending a few minutes each day on these points. The first point, LIGO. This point is located in a special spot. It's on the liver meridian, which in traditional medicine travels right through the genital area. So, stimulating this point can help directly improve energy and blood flow to the prostate region. You can find it on the inside of your lower leg, about a hand's width above your ankle bone, right behind the shin bone. The second point, Shenshu, in traditional medicine, the kidneys are seen as the source of our vital energy, and Shenshu is a key point for supporting kidney health. You can find it on your lower back first, find the bottom of your rib cage, then move down along your spine until you feel the next 2 bony bumps. From that level, move about 2 finger widths out from your spine. Pressing on this point with your thumb should feel a little sore, but in a good relieving way. The third point, Baliao. This isn't actually one point, but a set of 8 points. They're located in the flat area of your sacrum, just above your tailbone. You don't need to find each one individually. The easiest and most effective way is to rub your hands together until they're warm. Then use your palms to rub this whole area vigorously up and down until you feel warmth deep in your tailbone area. This technique is fantastic for boosting circulation throughout the entire pelvic region. It can work wonders for prostate issues and for relieving lower back pain and itchiness. Let's recap what we learned today. All right, friends, let's wrap this up and go over the key points one more time. Point one, protect your prostate with apples, 1 to 2 apples a day, every day. That gives your prostate the zinc it craves. Think of it as the most affordable natural antibiotic out there. Point two, avoid the four big prostate killers. First, stop sitting for hours, especially long bike rides. Second, ease up on heavy, spicy foods and alcohol. Third, keep your digestion regular. And fourth, find a regular rhythm for your sex life. Don't let your prostate get overworked or congested. Point three, know the 7 warning signs. Number one, a split stream. Number two, a thin stream. Number three, short range. Number four, start and stop urination. Number five, the shower head effect. Number six, post pee dribble. Number seven, frequent nighttime urination. If you have 3 or more of these, your prostate is sending you a serious alert. Pay attention. Point four, try these acupressure points. Massage Ligou every day. Press on Shenshu, rub Beliao until it's warm. When the blood and energy flow well in your pelvis, urination gets smoother. A final crucial reminder, and please everyone, remember this. Maintenance is not the same as treatment. If you are currently unable to pee at all, if you have acute urinary retention, severe pain in your lower belly, or if you see blood in your urine, do not rely on apples and acupressure. The methods we talked about today are like maintaining the road, but if the exit is completely blocked, you need emergency help. You must go to the hospital immediately and see a urologist for proper treatment or surgery, fellas. After 50, life isn't about who makes more money. It's about who lives more comfortably and with more dignity. It's about sleeping through the night. It's about feeling in control and at ease. I hope every one of you can use these simple methods to find some of that younger feeling again. I hope this information today becomes a helpful tool on your health journey. If you found this useful, please hit that like button and share it with the men in your life who might need to hear it. Here's to a good night's sleep and a comfortable, easy life from here on out. As always, this information is for educational purposes only. If you're dealing with any health concerns, please schedule a visit with your primary care doctor. I'm here to help you understand the science, not replace professional medical advice. I'll see you in the next video. Take care.